Hi, and welcome to our special series called Why Community Hospitals Matter. My name is Jeremy Rodrigo from Waterbury Hospital, and I'm joined today by Samaria Green. Samaria is our Director of Outpatient Behavioral Health and Crisis Intervention, and welcome to our podcast.
Thank you.
This series talks about what we do in our community, right? Like how we take care of people in this community, the greater Waterbury area. So tell me a little bit about yourself, about your background, your education, and what you do here at Waterbury Hospital.
Well, I am a marriage and family therapist. I also have a second master's in healthcare administration. I have been at Waterbury Hospital for about 15 years.
Really?
I was an intern here in the adolescent program, the children and adolescent program, 15 years ago. At that time, we serviced children 10 to 12, adolescents, adults, and for psychiatric services and addiction services. And I've been in behavioral health since then. I've been working in all levels of cares, from outpatient, intensive outpatient, partial hospital, and crisis intervention.
So tell me about what is behavioral health, if you had to kind of break it down for people who don't understand what behavioral health is. What is that?
Sure. Behavioral health comprises of mental health and psychiatric services, where we provide psychiatric treatment to clients who suffer from a variety of different psychiatric disorders, including depression, anxiety, schizophrenia, thought disorders, behavioral problems, and it also includes co-occurring disorders, which includes addiction.
Right.
So we provide a comprehensive programs for clients who suffer from psychiatric problems. We offer individual therapy. We offer intensive outpatient treatment, which targets clients who symptoms may be so severe that they are unable to function in the community, and that their psychiatric conditions are impacting their daily functioning. So we provide more intensive services for them. We offer addiction services, including mental health and addiction together, which is very important.
And those kind of go hand in hand, right? A lot of times.
Absolutely, absolutely. Mental health and addictions go hand in hand. We find that it's co-occurring, right? There are clients who have underlying trauma, who have underlying depression or anxiety or environmental factors that have affected their ability to thrive, and at times they may resort to substances to cope. And so we pay very careful attention to that, not to isolate addiction from mental health, but to have a holistic approach to it. So our program here at Waterbury addresses both.
And you find that there's a big need in our community for behavioral health and addiction services?
Yes, there is a significant need. We found that there is a high rate of clients who are struggling with addiction in the Waterbury area, in our catchment areas, our neighboring towns.
Right, because it's not just Waterbury.
Absolutely.
It's all of the communities that surround Waterbury.
Absolutely.
And it's not just any specific socioeconomic sector.
Doesn't discriminate.
It does not. Thank you for that. Right. It doesn't discriminate.
No.
It's everywhere.
It's everywhere, and our services targets clients in Waterbury and our neighboring towns. So we work with clients, refer from other towns, even as far as Fairfield.
Really?
Yes. Our focus obviously is our Waterbury population, but we service clients who are able to come, who are able to travel. We are a huge staple in the community.
So in terms of the treatment that you provide, and you call it intensive outpatient, that means that they come in every day and they have treatment.
Yes.
Right. But they don't stay here.
They don't stay here. It's on an outpatient basis. Intensive outpatient ranges from 3 to 5 days a week. It's about 3 hours a day. And the length of stay is between 6 to 8 weeks. Some clients stay longer, some stay shorter, depending on how their response to the treatment is. And the goal of intensive outpatient is to stabilize our clients so that they can, maybe enter back into individual therapy once a week, and or prevent hospitalization or frequent ED visits. And so that intensity helps them really learn the coping skills, manage their symptoms, get them started on psychiatric medications if needed, and really hone them in to learn how to live productively and to prevent frequent crises.
Now, do you find that this, for you, and obviously you've been doing this for a long time, this is a rewarding career for you?
Absolutely.
And why is it rewarding for you?
There's a lot of reasons why it's rewarding. I come from an environment. I'm from West Africa, Liberia, and I came from an environment that was full of trauma, I came from a war, and at that time, coming into the therapeutic environment, I wanted to help people who suffer from trauma.
Right.
And what I found over the years was that a lot of mental health and addiction problems, there is an underlining some kind of trauma.
Yeah.
And what I found here, and what it's really rewarding for me, is that I get to see patients, right, who are coming in with their symptoms, and from the outside it just looks problematic. But I had the opportunity to work with therapists, to work with licensed drug and alcohol counselors, to work with board-certified psychiatrists and APRNs, a holistic, comprehensive team that really go beyond just what we see on the surface, that cares about the patients, that focuses on their trauma, their underlying problems, that focuses on the system around the client, not just what's in front of them.
Right.
And to see the holistic approach really brings back the goal that I always had, was to help clients resolve the underlying problems. And I see that happening in Waterbury Behavioral Health. I see the compassion the team has. I see the compassion. Everybody put work into our patients, and I see the progress. We see clients coming in one way, and they're thriving. It's very rewarding.
And there has been a stigma associated with mental health, and we're trying to, as a society, I think we're trying to push that stigma away, that mental health is health, right? And the people who take care of you are professionals, and they're, like you said, a holistic approach, a team approach of all kinds of people who just want you to be well.
Absolutely.
Whether it's physically well or mentally well, we just want you to be well.
Yes.
Right? So why do you think that the work we do in this community hospital matters?
I don't think we have enough time to really gather enough information on why the work we do matter. I think we will sit here for hours.
Yeah, you're right. You're right about that.
But I would try to capture in a few minutes.
Yeah, from your perspective.
From my perspective, the work we do here matters because we serve an underserved population.
Mm-hmm.
We serve a group of people in our community that are brilliant people. They're unique people. They have unique goals. They have unique desires. They have a hope for their future. And it matters because we're creating an environment, a system where people are able to be productive. They're able to be mentally, physically, spiritually sound, mind, body, soul, and then they can give back to the community. We see in the Waterbury area that there's such a disservice here, from financial constraints to psychiatric barriers to addiction barriers. And what we're doing here is we're kind of grassroots. We're picking up people from the gutter, sometimes people from the bottom who have tried so many services. They've tried so many treatment options, and we're the backbone for them. We're picking them up, we're carefully assessing them, we're carefully addressing their problems, again in a very holistic way, and we're moving them from the psychiatric and addiction barriers to high functioning where they can service the community. When I say we're very holistic, we have peer recovery specialists that follow up with them to ensure they're in treatment, to ensure if they're homeless, that we're helping them find homes. We have a homeless outreach. We have We have connection with an agency that helps clients find jobs, you know, to help them be productive.
Yeah.
So it's not just a fraction of getting them to become mentally stable, but it's moving the whole individual,
right,
the whole unit, and sometimes the whole family. You know, we're family focused as well.
Yeah.
We focus on the entire system. So we are creating not just change on a psychiatric level, but on a massive scale. We're
Right.
helping clients be productive. We're helping clients give back to their community. We're helping clients add value to themselves, their families, and
Yeah.
to others. So I think that's why it's very important, especially in this area.
So this, you articulated that beautifully, by the way, and this is why we're doing this series, why community hospitals matter, and why the work we do here at Waterbury Hospital matters. Samaria Green, I thank you for your time. I know you have a lot of patients to see and help. Samaria is the Director of Outpatient Behavioral Health and Crisis Intervention right here at Waterbury Hospital. We'll see you next time. Thanks.